lymphatic system and some immune organs, also endocrine glands, you can see. At first, lymphatic system, today new topic. You have listened hard, this will be on next week. But lymphatic system, last week lecture, it is topic of our today practical class. Lymphatic system. Do you remember from what parts consist of lymphatic system? Lymphatic system connected with the immune system. It is additional stream to the venous system. Lymphatic is additional to the venous system. Consists of lymphatic capillaries, lymph vessels, lymphatic nodes, lymphatic trunks, and lymphatic ducts. Once more, capillaries, vessels, nodes, then trunks, then ducts. The initial part of lymphatic system is lymphatic capillaries. From capillaries starts. From all tissues, by exception brain, meninges of the brain, cartilaginous tissue, bones, and for example, cornea, lens, or in the eye, placenta. From all these organs starts lymph capillaries. Do you remember small intestine? Tunica mucosa of the small intestine has what? Villi intestinalis, yes? Intestinal villi. In the center of this intestinal villi we have lymph capillary. In all tissues like this starts lymph capillaries are located under the lymph capillaries under the mucosa of the digestive organs, respiratory organs, urinary organs, but they have blind origin. Turn your attention. You will describe all parts of lymphatic system and describe peculiarities of structure. All parts, capillaries, and compare with capillaries with blood capillaries. Then compare lymphatic capillaries with lymphatic vessels. What structure they have? They start blindly. Finger shape these capillaries in distinction from blood capillaries, in which in microcirculatory bed we have arteriola, which continues with precapillar, capillar, postcapillar, and venula. Through the venous outflow venous blood from tissue. But from the tissue starts also lymph capillary, which has, in distinction from blood capillary, which continues, yes, without interruption, continues. Lymphatic capillary have finger shape, leaf shape origin, and then under the mucosa form lymph capillary net. Net of the lymph capillaries. This net lies in one plane. For example, for the fascia, but in organs we have three dimensions, in kidney, in lung, in heifer, liver, just three-dimension direction. In all three directions are located lymph capillaries network. Together with blood capillaries, together lymphoid nodules, they are located with the glands under the mucosa. In lamina propria, under lamina propria of tunica mucosa of digestive, respiratory, urinary organs. And tissue fluid is outflow, absorbed into the lymph capillary, together with the macromolecular substances, which could not absorb into the venous, they absorb into the lymphatic capillaries. And lymphatic capillaries what function now? Outflow of the fluid from tissue and bring this fluid into what stream? Venous stream. It is additional stream to the venous system because all our lymphatic ducts, trunks, ducts, they drain into the venous, so-called venous angles. What does it mean, venous angle? Do you remember from lecture? Angulus venosus dexter and angulus venosus sinister. For the lymphatic system, have your foot volume of the arteries? No, lymphatic is not here. showed, on the neck, lower part of the neck, we have jugular veins and subclavian veins in this part. Junction, site of junction of vena jugularis interna dextra sinistra with subclavia dextra sinistra, this part is called venous angle. Angulus venosus dextra, angulus venosus sinistra. And our lymph ducts, right, drains here. Left thoracic duct drains here into the venous. This tissue brings into the venous stream, venous system. What structure have lymph capillaries? The wall of lymph capillaries. You remember from last lecture? Consists of only one layer of, open your textbook, lymph capillaries have only one layer of endothelial cells without basal lamina. The wall of lymphatic capillary, picture 41. Yeah, this picture. You can see only one layer of endothelial cells, very thin layer, without basal lamina, in distinction from blood capillaries. Only one layer of endothelial cells, and through the micropores between endothelial cells, interendothelial and transendothelial, directly through the endothelial cells, is absorb fluid from tissue into the lymph capillary. That is why structure and function, they are connected. We have intimate relation between function, structure and function. If the structure is so, one layer of cells, what function has? Metabolic. Metabolic function, diffusion of the fluid, absorption of the fluid from tissue to the lymph capillary. Absorption of the fluid. Metabolic function for tissues. And the lymph capillary then form lymphatic net and continues, gives rise to lymphatic vessels. Now, what structure have lymphatic vessels? Now, lymph capillary, next feature, they have wall, only one layer of endothelial cells without basal lamina. Next, they are wider than blood capillaries. Blood capillary have diameter from 2 to 9 micrometers, 7, 8, 9, from 10 to 150, 200 micrometers. Have lymphatic capillary, they are much wider. Lymphatic capillary, they are wider than blood capillary. You can compare here. Lymphatic capillary is more wide than blood capillary. Metabolic diffusion of the fluid from tissues absorbed into the lymph capillary. Help for absorption, not only into the venous stream is absorbed, but also into the lymph capillaries. Absorb this fluid. And we have transendothelial and interendothelial, two ways of absorption of the fluid. Next, lymphatic capillaries then form continuous with lymphatic vessels. But before this, I will explain lymph capillaries of the villi intestinalis. They have white color, white color, so-called milky ways. They are called intestinal milky ways because into the lymph capillary of the intestine are absorbed products of metabolism of fat. What products are formed? From fat during digestion in the digestive canal. Into what products it discharge? Fat from chemistry. Glycerin and fatty acids. Fatty acids, they absorb into the lymph capillary. Amino acids and the monosaccharides, they absorb into the bloodstream. But fatty acids absorb into the lymph capillaries. And this fat in lymph gives rise white color of the lymph. Fat in the lymph gives white color, that is why they are called milky ways of the intestine. And form lymphatic capillaries form lymphatic vessels, continuous with lymphatic vessels. Now, structure and function of the next chain of the lymphatic system, lymphatic vessels. You can open your lecture, it's all material of the last lecture. And you can line these lymph capillaries, then lymphatic vessels. What structure, what function have lymphatic vessels? Structure, wall of the lymphatic vessels, how many layers has? Find in your lecture. Lymphatic vessels has 3 layers of the wall. Can you find this? No? Endothelium, middle. No, what about lymphatic vessels? Lymphatic vessels have more thick wall in comparison with capillaries. They have more thick wall. Consists of 3 layers: endothelium, muscular, and adventitious coat. External is tunica adventitia, tunica media, and endothelium. More thick. That is why through the wall we have not in lymphatic vessels. Is not impossible. It is impossible diffusion. Yes, it is more thick. What function, in accordance with structure, that is why I have lymphatic vessel? In your opinion, what function have? If the diffusion is impossible, only transport, conduction of the lymphatic vessels. They serve for transport of the lymph. They are vessels for transport, but they have positive and negative significance. Lymphatic vessels help for transport of the lymph from organ to the lymphatic nodes, through the lymphatic vessels to the lymphatic nodes, from one organ to other organ, from one node to other. All this transfer is accomplished through the lymphatic vessels. But negative significance of the lymphatic vessels, through these vessels, it was not only transport of the lymph, but also transport of the tumor cells. Through the lymphatic vessels is accomplished metastasis. Metastasis of the tumor process from one organ to other, from one lymph node to other lymph node. That is why through the lymphatic vessels in one organ, for example, cancer of the rectum or a large intestine, but metastasis may be in the lung, liver, cancer in stomach, metastasis in the liver. Through the what part of the lymphatic system it is possible through the lymphatic vessels. Transport of the not only tumor cells but also products of inflammation. Also, they from one part, maybe inflammation only one organ, at first, appendix, and then conducted into all peritoneum, peritonitis. Through what vessels? Lymphatic vessels is possible. It is negative significance of the lymphatic vessels. This material of the lecture, I explained lecture, your last lecture.
No.
It's not so.
Ладно, continue. Structure of the lymphatic vessels. By, do you understand the wall and structure? Transport of the lymph. Lymph, translation of this word, it means clear water. But чистая вода, water, not clear water. In comparison with tissue fluid distinguished from lymph. In lymph are present lymphoid cells, lymphocytes. Fluid with lymphocytes, which find this or microbial agents and phagocytosis, or participate in macrophages, lymphocytes, participate in antigen antibody reactions, immunological reactions. Lymphatic vessels, by localization, may be classification of the vessels, may be superficial and deep, may be afferent and efferent. Afferent brings lymph to the lymph node, efferent outflow from the lymph node. And they differ by their number. Vasa afferentia, which bring to the lymph node. They are twice larger in number, greater in number. For example, 5, 6 come, only 2, 3 leave. Vasa efferentia and vasa afferentia, superficial and deep. Maybe parietal lymphatic vessels, for example, they pass in intercostal space, and visceral near the organs they pass lymphatic vessels. And next specific feature of the vessels in comparison with lymph capillary and blood vessels, they have the valves. Lymphatic vessels, if you want, you can join to my group. Lymphatic vessels, they have valve in distinction from blood capillaries. What we can find inside the vessels. Valvula, valves of the structure of the lymphatic vessel. It has paired valves allocated inside, and on the side, this valve is formed by what layer? Endothelial, inner layer. Innermost layer of the lymphatic vessel forms double duplication, double-walled layer of these folds. They form these folds. Please take away this back from the table, maybe chair of the department come. Thank you. And these folds, what significance have valvular apparatus of the lymphatic vessels? These valvular apparatus, in accordance with laws of the physics, in this part, pressure is higher than in front. From the zone of the higher pressure, under the pressure, this valve is open and lymph flow forward part of the lymphatic vessels. And behind, depressed pressure. The valves are closed. Here higher than here. Goes forward, behind is closed. Thus, in this, the valvular apparatus, in all organs, in the heart, in the veins, in lymphatic vessels, have for direction of the lymph, blood in one direction, only in one direction. In insufficiency of this valvular apparatus, in pathological condition, may be lymphostase, edema of the extremities develop. Because the lymph, for example, the main part of the body, from the main part of the body, lower part, it goes opposite to the force of gravity. Valvular, on the side of these valves, you can see lymphatic vessels becomes narrow. That is why it has the contours like smooth contour of the blood vessels. Lymphatic vessels have this shape, narrowings and widening, like necklace. You can see the narrowing corresponds to the site of localization of the valvula of lymphatic vessels. Next part of lymphatic system is called lymphatic node. Nodus lymphatic. Lymphatic node. Lymphatic nodes belong to two systems. They are peripheral organ of immune system, peripheral organs of immune system, and at the same time they are lymphatic nodes, peripheral organ of immune system. Central are thymus and bone marrow. We have this division of the central and peripheral organ of immune system. Immune organs are divided into central and peripheral by what base this classification. Organs in which are formed lymphoid cells, they are called central. Where the lymphocytes are formed, the lymphocytes in bone marrow and in thymus. Organs into which from this central organ pass into the tonsil, lymph nodes. There are reservation of these lymph nodes, but they are not central. In this organ are not formed, only reserved these lymph nodes. In the appendix, in lymph nodes of the organs under the mucosa, we have aggregation of the pairs patches, for example, in by the... Хорошо. Я продолжу. Хорошо, хорошо. А остальные ушли? Хорошо. Ладно, если продолжим. Значит, peripheral organ of immune system, lymphoid nodes, yeah? At peripheral organ. At the same, by organ of immune system, what function have lymph nodes? What function have lymph nodes as organ of peripheral immune system? Barrier. Filter is organ of lymphatic. Biological filter, filtrated. It is belong to lymphatic system, and as organ of lymphatic system, it functions as biological filter, like filter for water. Through this filter of the water, when it passes, it becomes more clean. Yeah? And the same function have lymphatic nodes, which flows. The lymph nodes function as a biological filter. Lymph, when outflow through the lymph nodes, becomes more cleaner. From organ to organ, it becomes more clean. Sometimes when infection is so large and immunity is function of immunity is decreased, and in this case, it's maybe inflammation of the lymph nodes also. This biological filters organ of lymphatic system and barrier, function of the barrier for infection as organ of immune system. It is organ of two systems, immune and lymphatic. What structure have lymph nodes? Lymph node structure. Next picture. It has capsule, cortex and medulla. But I haven't. I will bring through a fat volume of atlas. Nobody has this vessel. For the next class, starting from then, you will bring hard atlas next volume, not this.